doing well. So for today's video, I will be talking about interacting with parents in the NICU, which is such a huge deal as a NICU nurse. So it is actually like 2:30 in the morning and I just got back home from an event, and I really wanted to film before the event, before my hair got all frizzy and stuff, but I really did not have any time. And I was like, if I don't film now, then I will not, be able to post my second video of the week. And as you all know, my goal is to post 2 videos each week for the month of January, so I kind of have no choice but to film right now. So that's what I'm going to do. As I was saying before, interacting with parents is such a huge deal in the NICU as a nurse, because obviously our newborn patients can't speak for themselves, they don't understand what's going on, so you have to constantly update parents and let them know what's going on and have them participate. So when a newborn baby is first admitted to the NICU, when parents first come down, we like to give them a full rundown of the NICU, like all the rules and all the resources and just things that we like to have them participate in. So that's a very important part of it. Once parents start to get used to being in the NICU, we do have them participate in things like rounds, care time, so we may have parents check a temperature, change diapers, and help out with things like that during care times. We also really encourage parents to do skin to skin because that's very beneficial to their babies. It's also very important as a NICU nurse to be present during family meetings, so if there's something serious going on with your patient and you have a family meeting set up with the parents and the doctors, you want to be there present as the nurse. Another very important role that I have as a NICU nurse when it comes to interacting with parents and other family members of the patient is to provide education. Education is just everything. So we teach them how to change the diapers, because a lot of parents are, first-time parents, they don't really know how to do that. We teach them how to bathe their babies, how to check their temperature, the correct temperature range. We teach them pretty much everything they need to know, even if a patient is going home on respiratory support or with a feeding tube or a trach or something like that. We have to teach the parents all that stuff before they go home so that they are comfortable and confident before they take their baby home. As a nurse, we also comfort parents. A lot of times, obviously, no one is going to expect that their baby is going to end up in the NICU, so it can be a very difficult and sometimes sad time for the parents. So they may come in and be tearful, but we have to encourage them, let them know that they didn't do anything wrong and that we're going to be here for them to support them. So we may connect them with a chaplain or just different resources to help them feel better and give emotional support. Other consults that we put in would be the Ronald McDonald consult. So this is for families who live far away. We may put in a consult for them to stay at the Ronald McDonald House, which is kind of like a hotel. So it's close to the hospital and allows them to spend the night there for a few nights so that they are closer to their baby and that they can visit more easily. Obviously in the NICU, you are going to have moms who are breastfeeding or pumping, so we may also put in lactation consults. So a lactation consultant may come down and help out the moms with breastfeeding if they have any issues with that. So as the nurse, it is important for us to call a lactation consultant whenever a mom needs more support. So as you can see, family-centered care is super important in the NICU because, like I said before, our patients can't talk, they can't do anything, they don't understand what's going on. So we constantly have to update parents and keep them involved. And it's just such a great thing. When I first started, I used to be so nervous to interact with parents. And I'll admit, sometimes I still am, but for the most part, it's such a great experience. They just let you know how thankful they are, and they're just so nice and grateful. I love it, and you really do get to know the parents over time because a lot of our patients do stay in the NICU for months at a time. So, you really do get to get close with these families. Also, a lot of times families may bring in snacks for the unit, some donuts or muffins, just as a way to say thank you, which is really sweet. Obviously you don't want to accept things jewelry, diamond earrings. A little candy bar or something is fine from families, but you don't want to accept big gifts. I mean, you're doing your job, you're here to help their babies, so you don't really need to accept big gifts like that. But I will say that interacting with families makes you just feel so great about yourself. You're oh my gosh, this is what I was meant to do. This job is amazing, it's so rewarding, I'm really making a difference in these people's lives, and you're just so thankful. So parents may visit their babies 24/7 in the NICU, And they may also call whenever they want to if they're not able to be at the bedside. So when they call, you just want to give them updates and let them know what's going on. You always want to keep parents updated on the plan of care, and if there's something like, that's out of your, scope of practice as a nurse, you can always have the providers call the parents and give them a bigger update. Overall, I've had great experiences interacting with parents and other family members in the NICU. It's such an amazing thing. I really do enjoy it now that I'm not so nervous to talk to them and answer their questions. So if you do want to be a NICU nurse, just make sure you know that you do have to do a lot of interacting with parents and families in the NICU. So yeah, that was just a very brief video. I hope that you all found it helpful, and I hope you all have a lovely day. I will see you guys in the next video. Bye.